We have a special guest who's going to be joining us, so we want to make sure that we can be at the right place for when she joins us. Welcome, good afternoon, good morning. I'm Susan Poland. I am the Associate Executive Director for Public Affairs and Advocacy at APHA, and we are really excited to have you here at our September Alliance meeting. September, as you all know, I suspect, is National Preparedness Month. So our focus today will be on this key public health topic. In addition, September, October is Hispanic Heritage Month, and it's time to celebrate the rich cultures and contributions of this community and to recommit to working across across sectors to work with the communities and the public health challenges they face. One of the things that we can do to do this is to increase our access to culturally and linguistically appropriate healthcare services, promote health education outreach programs, addressing social determinants, and supporting Hispanic-owned and operated businesses and organizations. During our meeting today, we will explore with leaders in the field priorities for preparedness and response, including how partners from various sectors, including government, emergency management, community organizations, and healthcare, and obviously public health, can share best practices, build partnerships, and identify innovative solutions and practical strategies to address efforts to prevent, respond to, and recover from public health. I'm going to jump right in right now at the beginning of our conversation, and we'll have more time at the end for updates and announcements. So we're fortunate to have two national experts joining us today. Our first presenter will be Laura Biesiadecki from the National Association of City and County Health Officials. Laura is a Senior Director for Preparedness and managing a team and budgets of about $8 million dedicating to supporting local health departments' preparedness, response, and recovery efforts to all hazard events. She also serves as the programmatic and logistical lead for the nation's largest public health preparedness conference, attended by approximately 2,000 annual attendees. Laura's been with NACCHO since 2011 as the Director of Strategic Partnerships, Outreach and Education, managing the advanced care practice programs and other projects. She has an MPH from the University of North Carolina and a BS in healthcare and healthcare administration and management. And I'm going to turn this over to Laura. And just so you all know, I'll introduce Dawn O'Connell when she joins us.
All right. Well, thank you. It's a pleasure to be here amongst such an august group. I have been in touch with many of you in the past, and so thank you very much. Let me just share my screen here, and we can get going. So I'm going to talk to you a little bit about preparedness today from a lens of our preparedness profile. So again, I'm Laura Biesiadecki. I'm the Senior Director for Preparedness at NACCHO, and we represent the 2,800 local health departments across the country. And one thing to note, I was asked to kind of present this from a health equity lens. I'm going to talk a little bit about that at the end, but I'd like to talk about a different type of issue, and that is, one important stat to keep in mind when I'm going through my slides is 60% of local health departments represent communities with populations of 50,000 or less. So that as we're thinking through some of the numbers and as I'm showing you some of the data, we'll make a frequent reference to the issues that we're facing based on the size of the health communities that are being served. So we do a preparedness profile every 2 years or so. And in that, we ask what we designate as preparedness coordinators in local health departments about issues related to workforce response and planning. And so I selected a couple of slides that I thought might be of interest and how they might relate to the broader preparedness issues that are facing our communities. So I first wanted to talk about the healthcare workforce. And in this slide, we're asking kind of years of experience from preparedness coordinators, those who actually do response. And what we think is kind of important to note on this slide is that, as you can see, the numbers of preparedness coordinators with fewer than 2 years of experience and more than 20 years of experience have grown over the past several years. I'm sorry, can somebody, I'm getting a lot of feedback. And so what that shows us is, you've got a lot of young people coming in, and you've got an aging public health workforce that is growing. Over the course of the pandemic, you might have seen a large amount of turnover in health departments. And this is concerning to us because you're not really seeing a pipeline that is growing, that has the depth of experience to plan for and respond to any other events that are happening in our communities on a fairly regular basis. And so we see this as a weakening of the public health response workforce. And so we really believe that we need to call for a lot of training and education and development of staff across health departments. And as you can see, not shown in the slide per se, those numbers are exacerbated when you're talking about smaller health departments. So the next slide I want to talk a little bit about is kind of our volunteer groups. So local health departments and state health departments rely significantly on volunteer groups to help during response. The largest network of volunteer groups that local health departments most frequently work with is the Medical Reserve Corps. And the Medical Reserve Corps is a great group of folks, and they do a lot of response work. They have different mission response functions, and they bulk up both public health and healthcare during a response. We're about to release, NACCHO, as the coordinator of the Medical Reserve Corps, is about to release another profile report that's just looking at the MRC numbers. But in that, we particularly noticed that I can tell you that it's hard to recruit for volunteers that demographically represent their communities. So this is going to be a focus with the MRC, of our response and commitment to the MRC over the next couple of years, is to beef up that and support that recruitment, because it's important that for the volunteers, the community can recognize them, and that the MRC folks are aware of and can adequately respond to the communities most in need. So next slide. So I know we wanted to talk a little bit about the strength of partnerships, which, the old adage and saying is you never want to shake hands over an emergency. So we're really trying to strengthen partnerships among certain groups. And so we're asking questions about who they partner with. So I think a couple of things that are really important to note in these next couple of slides are, let's look at the behavioral mental health components and the partnerships there, which aren't particularly strong. As you can see, there's about 38% that have port-of-fare relationships with behavioral mental health communities, particularly post-COVID, when we're seeing a lot of workforce burnout and a lot of community burnout. We think that this is something that we're going to have to address in the near future. Also want to call to mind the idea of chain pharmacies. Pharmacies were especially important during the pandemic, and for important distributors of vaccine. So the fact that these relationships aren't as strong as they possibly could be is of concern to us as well, and there's something that we're going to look to address in the near future. They have great relationships with their community partners, but the chain pharmacies are a different story, and that could just be because we're not sure if the local health departments can really reach that national level and have a national relationship that could impact across the board. So this is a slightly different take on some of the partnerships activities, and this is more like community government types of partnerships. As you can see, some of the ones that we would like to beef up is this concept of social services partnerships. Preparedness hits so many of our government sectors across the board. And this idea of public health connecting with social services in order to provide some sort of wraparound services to communities in need during an event is something that we're paying increasing attention to, and that we've been trying to partner a lot with ACF on to do a little bit more of that, thinking about wraparound services for response. As you can see too, local businesses is something that we would want to beef up. And of concern too is this idea that there's not a lot of partnership with intelligence and security industry. We really need to understand that better, why that is, and is it just a lack of ability to maintain the partnerships, which is what we think it is. Because as I said, when you're thinking about the kind of urban-rural disparities, if you're only talking about communities that maybe have one person that's representing their health department, their time spent building and maintaining these relationships is difficult, and they're stretched very thin. So how we can support them on a national basis to grow and develop these partnerships is particularly important. I want to keep track of my time. So next slide. So this is because I'm a preparedness geek and I like data. This slide is always fun for me because we like to take a look at. We asked our members, what do you feel most concerned about, and what do you feel least prepared to respond to? And so we've been thinking about this one for a long time because, as you can see, we look at storms and flooding and see that 50% still are not quite sure that they feel really prepared to respond to storms and flooding, yet there's nearly 3/4 are very concerned about it. And considering the amount of investment that has been given in preparedness over the past 20 years, this has really been something that we wanted to look at a lot more closely. So we recently did some qualitative information gathering to take a look at this a little bit more. And it turns out that what comes up is a lot about extreme weather events and climate change. And so addressing that concern through training, exercising, and other types of mechanisms is something that we want to look closely at. Other issues that on this chart that I think we need to take a look at into the future, as you can see, medical supply chain disruptions. That was a huge issue during the pandemic, and it's something that we're increasingly want to look at, because considering that only 11% feel really prepared to address that. And I know that our next speaker is very concerned about this as well. And so we're taking a look at working with some of the industrial manufacturers and see how we can connect and come up with triggers and how local health departments and some of the industrial manufacturers can work together. Okay, I have to move my faces around so I can see all the slides. So I also on this, cybersecurity is on this. I thought the slide's not showing up the name. So that's something else we want to take a look at. I know it's been a topic of interest from CISA, and so we are beginning to address that as well. So this slide is a heavy slide, but again, I wanted a couple of things I want to highlight because it mirrors the most concerned and least prepared slide. And then it takes a look at what are their communities really doing to address some of these issues, and how are they implementing it in terms of planning, training, and regular coordination and outreach. And so I think we'll see a couple of things that are expected, and a couple of things that will mirror the concern that we had on the other slide. Because if you look at, they're very concerned about storms and flooding, which we qualitatively understand is about climate change. But if you look at the bottom, 65% of our health departments are reporting that they have no activities related to climate change. And that's something we want to take a further look at. Is it because they don't feel comfortable talking about using the terms climate change? Is it something that really they feel is an environmental health issue and is either in their environmental health departments or in different parts of their community? But considering the impacts of cascading events affecting our country, I think this is something we want to take a look at and begin to figure out how to normalize that a little bit and how to best address the needs within our communities. Again,
Laura, I'm sorry, I don't mean to interrupt you, but we're at that time. So
okay,
we'll come back to you in just a couple of minutes.
Great.
But it is now my pleasure to introduce ASPR O'Connell. ASPR Dawn O'Connell is the Assistant Secretary for Preparedness and Response at the U.S. Department of Health and Human Services. She leads the nation's effort to prevent, respond to, and recover from public health emergencies. Prior to this role, she served as Senior Counselor to Secretary Becerra for COVID-19 and the Director of the U.S. Office for the Coalition for Epidemic Preparedness and Innovation, or CEPI. She also worked as a Senior Counselor to HHS Secretary Sylvia Burwell, Deputy Chief of Staff to Secretary Sebelius during the Obama-Biden administration. ASPR O'Connell received a Bachelor of Arts in Literature from Vanderbilt and a JD from Tulane. Thank you so very much for joining us today. We look forward to learning from you about our national plans for preparedness and response and to look for opportunities for collaboration. ASPR O'Connell, I turn it over to you.
Susan, thanks so much. Listen, it's terrific to be here with each of you. Whenever you guys invite me, I'm happy to come and have an opportunity to talk about priorities and things I'm thinking about and getting some feedback from you all on things we might focus on. So as I think about where we are right now, thank goodness we are, we're 3.5 years into a COVID response. COVID is not over, but we are beginning to turn the page on some of the things that we needed to do. Last week, we've now seen the first of our seasonal COVID vaccines made available, and it's the first time it's been made available in the commercial market. Up until now, folks on my team have been purchasing and distributing the vaccines. So it's nice to get to a point where we're starting to get back to normal practice. We're about to announce, and it's coming any minute now.
Thank you so much for your patience and your willing to be flexible. We'll turn it back to you to finish up your presentation and then open it up for further conversation.
Great. Thank you. I actually just had one more slide that I wanted to kind of talk about, and that's this concept of, and I won't even put my slides back up, administrative preparedness, which we think is, increasingly important. And we define administrative preparedness as this idea of how to move people, money, and stuff around in an emergency. And we're finding that, for example, people, and we know that workforce was so strained during the response, only 25% of local health departments really had a formal mechanism in place for either hiring quickly or moving people from one project to another. And this idea of a formal mechanism, particularly in those smaller health departments, is so important because with the turnover, you can't really rely on informal relationships all the time to make and strengthen the response. You really have to have some formal mechanism so that if somebody's coming in behind you, can rapidly pick it up and know how to quickly either have the authoritative responsibility that's already set up, or working with, figuring out what the union issues are, to really figure out how to hire quickly or move from one place to another. And that includes having the ability to move funding from one place to another in order to appropriately get staffing up. And so those are the big things that are really we're interested in. All this data is going to be published with our recommendations that it's going to be coming up early next week. We're also going to be soon publishing the results of a journal supplement that we commissioned several years ago. And speaking about the Preparedness Summit, we did a series of COVID listening sessions at our 2022 Preparedness Summit, and then invited our planning committee partners to write journal articles talking about the future of public health and post-COVID era. And all the results of that are going to be published in a issue of Health Security that's going to be coming out in the next several months. So please keep an eye on that. We have some authors of journal supplement articles that are on the call today. And so we're very excited because I think that's the first opportunity we've had for a lot of members of the practice community to sit back and reflect on their lessons learned and how that's going to impact the future. And so I'll say thank you very much for the time, and I really appreciate the opportunity to talk to you all today.
Laura, thank you so much. At this point, we have some questions for conversation. I think if anybody has any questions directly for Laura, please feel free to jump in with those, but I'll turn over the rest of this conversation to Angie.
Thanks, everybody. So a little different organization today, but just wanted to give people first a chance to reflect on kind of what we heard from both Laura or ASPR O'Connell. So we'll open it up now if people want to jump in with a question or a comment. Michelle.
Hi, yes, great to see you, Laura. Thank you so much for your presentation. It's so exciting to see when NACCHO puts out new information about local health departments and the things that they're facing out in the community. And thank you again for kind of providing us with some of those announcements and what to look out for. One of the questions I had, and perhaps it's something that you have in your information collected, and I might have missed it in one of the slides that you shared, but did you gather any information in your 2022 assessment related to public-private partnerships? I think that one of the things that I recall from kind of 2020 and into 2022 was this massive influx of private companies coming to local health departments and state health departments and all other associations with the willingness to help support public health during that time. And I know that one of the challenges is, like you said, you don't want to exchange business cards during an emergency. So recognizing that there may be an opportunity to think about the future of what public-private partnerships look like, and the opportunity to support the field with perhaps vetting some of those public or private partnerships for folks who've never experienced or engaged with private partners in the past. So do you have any information related to public-private partnerships that you all collected in the 2022 survey?
Hi, Michelle. So good to hear from you.
Hi.
So we collected those 2 slides of partners, and I think we realize that may be a future investigation we have to do, because I think there's a number of industries that I think we're going to have to be somewhat specific on, right? So I think you can look at pharmacies, because that's essentially a public-private partnership, and you can look at the chain pharmacies in which there's not necessarily as strong of a partnership with national chains, and kind of use that as an example of how we might really need to think about national partnerships of larger industries, right? And because it's just the amount of time state and local health departments have to develop these relationships. Also, how do they get to the people that can make the most difference across the widest swath of the population? So I know that, and so that's one example. And I think that if you try to extrapolate that to like the Googles of the world and other industrial manufacturers, I think we're going to have to give some thought as to really what is the most appropriate interaction at the local level with these public-private partnerships, and then how a national relationship can be developed that could inform that state and local relationship. Is that making sense, right?
Yeah, no, absolutely. Thank you. Thank you for your thoughts on that.
Great. Other questions from the group? If not, I may turn us to one of the discussion questions we had, but know everybody, this is a space we work in, and just want to think about what we can do to make sure that as a nation, we all become a little more prepared and ready to deal with currently COVID and the next big pandemics or emergencies occurring.
Angie, I'll ask a question.
Sure.
So, hi, Laura.
Hi, Oscar.
The question I have, especially when you just talked about the several areas, especially ended around administrative preparedness, and how that in of itself speaks to the upstream concerns that are beyond the quote unquote typical preparedness window. What are the aspects that you think will be helpful, especially as an alliance, for partners to be able to help on that endeavor? Is it a policy-driven approach? Is it more congressional outreach, or is there a mix of the above? What do you perceive as ways of others can help in this space?
Well, thank you very much for that question. And I know you coming and from also understanding a lot about public health law, I think it's going to have to be a mix of things, right? So because the issues are so extraordinarily complex and so diverse in every community, there's going to be different drivers for what's going to impact that administrative preparedness piece. You know, again, we mentioned unions, we mentioned grant authority, we mentioned legal authorities, and that's all driven by different types of relationships you have, particularly in those small communities. I think some of these answers are going to have to be driven by federal policy in terms of what kind of flexibilities are going to be allowed at the state and local level, and then I think followed up by better kind of thoughtful planning at the state and local level and relationship building in order to kind of work that out. Because if, you know, some of our health departments have a hard time, you know this, even accepting dollars that come down. And we were finding that over another slide that over like nearly 60% of our local health departments have no idea where their supplemental funding came from in the emergency. And so we're advocating for increased funding to reach the local level, but not even sure how our communities know what they have, because the complex is it'll come to the state level, it'll get mixed up with a bunch of other dollars, and it'll come out in a formula to the locals. And then at the local health department itself, it may be, again, put into a formula and then just them given to the health department. So it ends up being very complex to tease out exactly what they need. So I think there's going to have to be an advocate for a little bit more investigation about all the complexities that go into this piece and what the legal authorities are required, as well as the administrative grant authorities that are required to really make a difference.
Thanks, Laura. I know we've had you on the spot for a bit here, but I want to hear from others who work in this space. Are there other things that you think, I think that question Oscar just asked, of what is it that we as a group can do to really help to make sure that we are prepared and ready to respond and be resilient? Would others like to add in some thoughts that for the whole? And Donna, thank you for sharing resources. And Pam, hopefully your question was answered, but if not, we'll let Laura either answer in the chat or get back to that in a minute. Anyone, what do we need to do to be prepared or better ready? Avinash.
Yeah, thanks. I think people have spoke about it already, but I think the true understanding of what a private public partnership truly is and be ready for it. I can remember being the state health official in New Mexico, and we just could not pivot fast enough. We really couldn't retool our people, and we couldn't retrain our people. And sometimes there were even union limitations to what we needed to do with our employees, but we could not do. So I think just absolutely be ready from the procurement side to be ready to activate and engage private partnerships to start to get some of the work done. I don't think we were as ready as we were, and maybe we're a little bit more ready now. I still worry, you know, we have so many vacancies in the public health sector. 47% of positions are still empty across the country. So if we're ready to quote pivot the next time we need a pivot, and we're still, you know, we're half empty in our office spaces, it's not going to be possible. So I think that there's a hope that we're going to be able to use our public health employees and our staff, but I think in reality we won't have those staff when the next crisis is necessary to activate our private partnerships. So That's kind of what I'm thinking. We need to fully prepare from a legal perspective as well as a procurement perspective to activate community members.
Thank you. Do others want to add on to that? Is that what you saw at the local level or in state or other partnerships in your different dealings? I mean, certainly, as you all know, as the Alliance, we certainly heard that the need for broader community partners for really making sure that we have those true relationships ahead of time, that making sure we're figuring out how to bring in new workforce members. So can we get to community health workers? Can we learn how to bring in community-based partnerships and organizations will be really key. I know there are a number of you all who sit kind of a little bit more in the private sector. Are there things that you all saw during the pandemic or that you think are places that you really see a gap or an opportunity that we should fill? Or others, if you have thoughts. Donna, thanks.
Sure. Hi, Angie, and hi, everyone. Excuse me. Preventive medicine physicians, we have 43 residency training programs across the country. And, when you think about preparedness at the local health department level, we would love, and we continue to say, we would love to see preventive medicine trained physicians at every health department. So from our point of view, that is one of the key lacking skills and positions anyways in each of the health departments. And it's a matter of pipeline, like the rest of the public health workforce is really building up the pipeline with trained, skilled, knowledgeable, educated, prepared individuals that can step into those roles and really hit the ground running. So that's an ongoing challenge that we face. And, thank you to many of you who have advocated on our behalf as well for funding for residency programs and really helping to build up that pipeline.
Thank you. Yeah, I see workforce is certainly an issue rising to the top. Heather, I'm guessing there are things that we need to think about with pediatricians and kids also.
I think I would just echo a little bit of what Donna mentioned in terms of just connecting with our primary care pediatricians. Of course, that's who we think about at the Academy. But I think seeing the vaccine rollout and wondering how we were going to get that into those primary care settings where, kids are still even behind on vaccines, let alone COVID-19 vaccine. So thinking about how we can, again, build those public-private partnerships, as everyone has already said, now and strengthen those now so that some of the infrastructure, but also just even the physical needs of, like, whether it's refrigeration or whatever else, how can we make those things happen ahead of time so that we can use those primary care settings as a real partner in terms of the response for future emergencies. So thanks.
Thanks. And I think that's a question for many of you. I think Donna and Heather, just because you just spoke, it kind of came to mind. But I know for public health, as we've heard, we tend to have a lot of yo-yo. The next disaster happens, funding goes up, funding goes down. I hope that people at least think preventive medicine physicians and pediatricians are necessary all the time. Are there ways that we can be better partners together or kind of lift up these issues more regularly, that ideas you all would have or just others on the phone? How can we kind of have these long-term partnerships that kind of get this need to be prepared all the time so that we can kind of pivot, as Avanesh was talking about, once something big happens? Thoughts? Do we need the right data? Do we need some new type of partnership or new type of, relationship?
Angie, one of the things that I'm most encouraged by is that we've had at least 4 conversations with local health departments about standing up residency programs within their health departments. There are existing ones out of the 43 across the country, in Sacramento, in New York, in Texas. But the encouragement of so many that have stepped up to say that they are interested in standing up a residency program. On our ACPM, on the American College of Preventive Medicine's website, we have a podcast series. If any of the local health departments that are part of this call are interested in learning more, please reach out to me or go on our website. But there's a whole podcast series of how to stand up a residency program in a local health department. It takes about 2 years. So it is a longer committed journey, but with a lot of the workforce dollars that have come through CDC, that might be an opportunity to stand up a sustainable infrastructure that can last into the future after that 5 years of funding it expires or goes away. So that's one of the opportunities that comes to mind for me.
Great. I'll go Heather and then Avinash.
Yeah, I would just mention, I guess, a couple of things that we're trying to do on our end I know we're a national organization, but trying to build up our state-based affiliate partners. And we're designated in 16 chapters right now with a disaster ambassador. So at least helping maybe identify one person who could be a good contact, in addition to our chapter staff, of course, but our pediatrician members who are particularly interested in doing a better job looking at the needs of children in disaster preparedness planning. And then also just some of the project-based work that we're doing right now to help, again, build those relationships. It's very specific to certain surveillance programs and things like that, but are there other ways that we can look at future grant opportunities outside of disasters that might help at least build some of those relationships, help us know where to go for that data, help us know what to do with that data and how to get it back out to the community so that folks can stay informed and just have those relationships established beforehand. So
that's great. I love the term disaster ambassadors. So maybe we can all find people ready to do that. Avinash, did you have a thought or did you put your hand back down? Sorry.
No, I just wanted to ask if the Alliance has any members from our nursing colleagues. Are there any here today? And have we included them? Because a lot of the deficit, I feel, at least here within the state of New Mexico, we had a crisis with public health nursing. Just did not have enough people. It wasn't compensated enough. And then there was a deluge of individuals that left public health nursing to do clinical, like in the hospital nursing, because it was paying so much more. So that is going to happen again unless we think about that. And I wonder if our nursing leadership have ideas on how to plug that possible, deluge that it will likely happen again. I'm just wondering if we can be more prescient when we approach this in the coming for disaster preparedness.
No, that's a great point. We do have leaders from nursing. I'm not sure if they're here today, so anybody jump in if you are here. But yes, certainly a huge issue that we saw and a great idea to have some proactive discussions with them also. Okay, so I know we kind of called on our healthcare partners. Oh, Janet, go ahead.
Thanks so much, Angie. And thanks always for this conversation as well. It's a wonderful time and space to take a step back from some of where we're all focused all the time. And I maybe wanted to raise two issues. One, in terms of sort of what can different groups do. I will let people know and would be glad to share this afterwards, but we did just finish an update to the applied epidemiology competencies, which is, if you're an epidemiologist working in a health department, sort of what are you what should be your skill sets when you start? What should be your skill sets as you grow and develop in your career? And I think I'm highlighting that here because I do think there's opportunities for all of us to look at what are those competencies within our fields and how can we help others prepare those? So I think we've definitely seen and I've heard from my members that those coming out of schools of public health really aren't ready to be an applied epidemiologist. And so part of that is defining sort of where the gaps in terms of what people are missing. And I would definitely say that we have a lot of gaps around the data skills that are needed now within health departments, both sort of using that data as well as putting together different types of data visualizations. So that's one piece. And then the other thing, which probably a lot of you know, but I cannot help but not highlight it here if you're not aware that this is around the funding piece. And I think we heard a lot from ASPR O'Connell around, the need to protect what we have. And there is currently some proposed legislation that would cut dollars to the Prevention and Public Health Fund. So, almost $1 billion there. And that's 10% of the CDC's budget. And it's going to impact epidemiologists, laboratorians. It's going to impact across the board preventative services. So I do want to highlight that for folks and really encourage all of you to step up now and today to ensure that we don't have additional cuts to dollars that have been funding public health for a very long period of time. These aren't COVID dollars. These are prevention and public health fund dollars, and happy to share some additional information with this group too.
Thanks, Janet. I think that's super important that we also have to keep in mind kind of these bigger policy issues, to think about data, and also just to make sure that we keep the funding that we do have, as limited as it is, and hopefully together can figure out how to raise that in the future. I know we did want to allow some time for some quick updates at this meeting. So as always, we will share these resources once the meeting's over. If there are other things that you'd like to share, please do. But we had a couple updates that we wanted to start with, and then a couple from you all, and then please share them. So we already talked about the fact that it's National Hispanic Heritage Month, so happy to celebrate that with everyone. Our annual meeting is coming up in November. We're really excited to have a lot of you all there to hopefully continue this type of discussion, learn together and figure out how we can support and lift up public health. The Alliance will have a booth, we'll have other sessions, and really look forward to seeing you all there. We also wanted to just put out that our remaining Alliance meetings for the year, we'll do our normal meeting time next month. But the November time is actually during the closing panel of our annual meeting, where we'll actually be talking about where to go next in the public health system. So I hope you all can join us for that. We also know the end of December is not the best time for a meeting. So what we thought we'd do for November, December is actually plan a meeting right in the middle. So we'll have our meeting December 6th. Hopefully you all can join us, and that'll really wind up the year for everybody. And we'll dive into some interesting topics during those two also. If you'll go to the next slide, though, we wanted just to let people have a minute to put things in the chat, to raise hands, to help us think about things that you'd like to update the group about. And I have a couple if people don't, but I can also put them in the chat. Anything that you all are dying to share with the group, we would love to have a chance to let you. Donna gave us a good update. Janet's giving us some documents. What else? Yes. I see SNR 3. We're trying to give an update. Okay, well, please put things in the chat. Just a couple things while you're thinking that I wanted to update from colleagues. One is there is a National Public Health Law Conference coming up at the end of October. Hopefully many of you all be there, and we can think of some of these issues around how we make sure also that we're legally prepared. Our colleagues at the Public Health Institute who talked to us last time about Together Toward Health let us know that they're now recruiting for their first batch of the Together Toward Health Equity Fellows. I think that's just open to their current grantees, but they have a website that will share with you something exciting for us to follow going ahead. Our friends from CDC Foundation reached out about the work they're doing with Kaiser Permanente, working with public health and community-based organizations. They're looking for some strong partners to interview as part of focus groups. If you all have ideas of people that would be great, let us know, but I will also, we'll send you the criteria and definitely let us know if there's anything that you would like to share. I think those are the ones that people told me ahead of time, but anything else? All right, if not, I think it is right about time. So thank you so much for joining us all. I really appreciate Laura. Thank you for being flexible and for giving a great perspective to us about, local public health and a lot of the priorities we're seeing nationally. Thank you to many of you all for all you do. And we'll look forward to continuing these discussions in our next months. Thanks, everybody.